Hello and welcome to one and all. In this class, we will move on to the next topic, that is health. What is the role of health in economic development of a country, and what about the health policies and programs initiated in India? Okay. Now, first, who is a healthy person? How do you define this person is a healthy one or otherwise? So, who is a healthy person? So, if you uh, go by the meaning given by the World Health Organization. So, according to who, it is a person having physical, mental, and social stamina. So, this is, it's not the same quotation, the meaning is this. So, it is health means what? It is not only lack of ill health. So, as long as you're not having fever or cold or something like that, you're okay, means it's healthy. It's not considered as that. That is only the physical. So, mentally also you should be strong, and socially also you should be strong. You should be able to withstand all the criticism, isn't it? So, it is not only strong body, it should be also a strong mind. Okay. So, that person is considered as a healthy person. And healthy labor force, of course, it is one of the most important contributor for the quality of human resource in the country. So automatically a healthy labor force in the country contributes or improves or contributes greatly to human capital. Okay. Now, there are certain policies initiated by the governments since at the time of independence to improve the health standards in the country. So first, initially, that is the health policies in India. So the government appointed two committees to provide the suggestions to uh, improve the first of all, provide them what are the health standard facilities to be provided and how to improve the quality of health facilities in the country. So the first committee, known as the Health Survey and Development Committee, in 1946. So those periods of time and all, the health standards in the country were very poor, and lot of epidemics and all were happening in the country. So many vaccinations were not invented during that period of time. So health standards were literally very, very poor during that period of time. So that one committee was appointed in 1956, and later in 1961, another committee known as the Health Survey and Planning Committee. So this committee was appointed in 1961. So it's popularly known as the Mudaliar Committee. So these committees suggested some gave some recommendations to the government. So based on the recommendations given by these committees, the government set up some objectives. So objectives based on these committees' recommendations. So what ought to be uh, immediately done by the government? What are all the provisions to be done by the government at that point of time in order to improve the health standards in the country, considering the situation at that point of time? Okay, so the first one is provision of provision for the control of epidemics. So as I mentioned that there were so many epidemics. We did not find the cure for so many diseases. We did not find the vaccination for so many diseases. So it was so many epidemics were happening in the country. So that control provision has to be made in the country to control all those epidemics. And then second one, providing the normal or the basic health services to the people. So it is not only controlling the epidemics, isn't it? The basic health services also should be provided by the government. See, remember these are all starting from 1946. Just we 1 year later we were getting the independence. So the condition was very, very poor during those periods of time. And the third one, training of employees in health department. So it is not only, you need, suddenly you can't find doctors everywhere, isn't it? So apart from doctors, people have to be trained in the health to give health services, which are paramedical staff, or in other words, in the rural area, we call it as Anganwadi workers, isn't it? You must have heard about them. So that's providing the normal people to give some training so that they will be equipped to provide health services to the local people. So the training of employees in health department should be provided. And then because it is not possible to establish a hospital or a clinic at each and every corner of the country, especially at that point of time. So some facilities should be available, some knowledgeable people should be available in each and every area to provide the required health services to the local people. So that is the training of employees in the health department and development of primary health centers. So primary health centers basically deals with children, because children are the most vulnerable sections of the population. They are prone to diseases and everything. So to tackle that, to treat them, first importance was given to the establishment of primary health centers. Okay. So these were all the objectives based on the recommendations made by these two committees. And in the previous class, we have seen that the government announced the first national population policy in the year 1976. That was coinciding with the fifth five-year plan. So in the fifth five-year plan, along with the family planning program, the government integrated these health programs also along with the family planning program. So as I mentioned before in the previous class, the family planning program should be a comprehensive one. It has to be mixed with the health programs also. So when the government is announcing the health program, it included the health programs along with the family planning program. Okay. So periodically the government has been announcing the health policies from time to time. Just like the education policy, the government also has been announcing the health policy, even population policy for that matter. So the government has been announcing the health policies also from time to time. So the recent policy was announced by the government in 2017. So let us see what are all the main objectives or targets of the National Health Policy of 2017. So key targets of the National Health Policy 2017. So the first and foremost, increase health expenditure of government from the existing it was only 1.5% to 2.5% of the GDP by 2025. So if interested, I'm giving you some assignment. You can check out what is the expenditure incurred by some of the other countries and find out where we stand, where India stands. Okay, currently, what is the expenditure incurred by some of the, you take both the underdeveloped countries as well as the developed countries and compare it with India, how much, what is the difference? Okay, so that will give you some idea. So this is the target increase ever 1.5%. This should be in 2025. See, for if you want to know the data as far as India is concerned, the total health expenditure. Let us check out year-wise. I mean, in the previous years, how much was the expenditure incurred by the last couple of years in GDP? In 2001 to was 4.6% of GDP. Okay, out of this, public health expenditure was 0.94. See, these data will give you a clear picture. So it was, what is the target here? The existing 1.5%. This is in 2017. In 2001 and 2, the expenditure on health was 4.6% of the GDP. That means from 4.6%, the government has reduced to 1.5%. That is the indication here. So out of this also, the public expenditure is health expenditure is was only 0.94%, whereas the private health expenditure was 3.58%. So all these data will give you an idea. And external support from abroad, that means 0.11%. Okay, and when you take 2011, it was reduced to 3.9%. So out of the public 1.2% and private reduced, it also reduced to 2.7%, but still it is more than the public expenditure. And 2018-19, it is 1.5%. This including drinking water. It's not only the basic medical and health facilities, including drinking water, sanitation, etc. The expenditure incurred in this area is only 1.5% of the GDP. So from 4.6% for this massive population, even this 4.6% is also not sufficient. But on the top of it, the expenditure on health decreased from 4.6% to 1.5%. But then the target anyway fixed is it has to be at least 2.5% of the GDP by 2025. Okay. Anyway, that is the first target of the national health policy. So all these data will give you an idea what is happening. Okay, then the next is the increase life expectancy at birth from 67.5 years to 70 years by 2025. And as of 2011 census, it is almost same 68.5 years. Okay, so that if you side by side, if you check the achievement also, you will know where all, in which are all the areas we have achieved, the plan objectives have been met, which are all the areas we have not been able to meet the plan objectives. Okay, this is the second. And then the third target is the reduction of total fertility rate. I explained in the previous class what is the meaning of total fertility rate. The data also we have seen. Total fertility rate to say 2.1 per woman. Okay, 2 children per woman. That's what we mean at national and subnational. That is even including the state level also, subnational level. So if you see the, as of the 2019 current total fertility rate, current in the sense 2019. So 2019, it was 2.20 births per woman. Okay, and it was 2.3 in 2013. So there is an improvement here. So from 2.3 reduced to 2.2. Anyway, it is 2.1. So it is, there is a achievement. We can say that we can meet this target. Okay. Then the next one is the, this also we have seen in the population policy, reduce infant mortality rate to 28 by 2019. So in the population policy, we have seen below 30, isn't it? But here it is 28. So what was the infant mortality rate? We have checked, isn't it? It was 34 per thousand babies in 2016 and 37.8 per thousand in 2018. In fact, it has increased. Okay, so still we have to work on that. Okay, so that is the fourth objective. And coming to the fifth one, to reduce the prevalence of blindness to 0.25 per thousand by 2025. And disease burden by 1/3 from current levels. So that's why the government has been, of late, the government has been providing the free cataract surgery to most of the poorer sections of the people. So these are all the certain areas. If the proper medical aid is provided by the country or taken by the people at the appropriate time, this kind of illness can be prevented. Blindness and all can be prevented. The cataracts, they are all can be prevented if appropriate treatment is given at the appropriate time. So for that, the government has fixed a target 0.25 by thousand per thousand by 2025, and the disease burden by 1/3. I mean, whoever is say cataract, it will develop over a period of time. So whoever is expected to be having that kind of problem or blindness and all, so that has to be decreased by 1/3. Okay, then sixth one, increase utilization of public health facilities by 50%. By 50% from, highlight is, from current levels by 2025. Because majority of the people, they are preferring to go to the private hospitals and institutions. So the government wants to increase, make the people come to the government hospitals and clinics, because everybody knows that the fees is relatively lesser in the government hospitals compared to the private hospitals. So the government wants the people, poorer sections of the people, they cannot afford, isn't it? And so in order to avoid that, the government wants the people to come to the government hospitals for any checkup or for any treatment. So from the current level, it has to be increased by 50%. People should start using the government hospitals and clinics more and more instead of going to the private hospitals and clinics. So that is the meaning. Then the next one is more than 90% of the newborn have to be, are fully immunized by 1 year of age by 2025. So immunized, giving the correct vaccinations at the proper time, correct vaccinations, starting right from the first month after the baby is born. There are different vaccinations to be given to the babies. So since the infant mortality rate is high in the country, if the newborn babies are properly vaccinated, provided the injection, then automatically the infant mortality rate will come down. So in order to achieve that, more than 90% of the newborn should be given the appropriate vaccination. That is the immunization. Okay. Then the eighth one is ensure skilled attendance at birth. You can highlight this also. Skilled attendance at birth above 90% by 2025. So in the population policy, we have seen one target. At least 80% of the delivery should be happening in the hospitals, because most of the rural people, they don't even come visit the hospitals. That's why the MMR and the IMR are high in the country. So this has to be one thing. The deliveries have to be happening in the hospitals, and skilled attendance, the proper doctors, nurses. There's some special nurse called the ANMs. All those facilities should be available in the hospitals. So that has to be increased by 90% by 2025. Okay. Then the next target is the relative reduction in prevalence of current tobacco use by 15% by 2020 and 30% by 2025. This, I really don't know to what extent the government can induce the people. These are all voluntary. So at the most, what is done, smoking is injurious to health. That's all the warning signal can be given. Beyond that, it is the individual initiative. Then access to safe water and sanitation to all by 2020. So this one, actually there is a report given by World Bank. So as per the World Bank World Development Report, in our country, so World Development, so water and sanitation, safe water and sanitation. So World Development Report indicates that in our country, only 86% of the population, they are having the access to improved water. So that means for the remaining 14%, they don't, of the population, they are not even having that proper safe drinking water. As well as, and as far as the sanitation is concerned, only 33% is of the population in India is having the improved sanitation. So remaining 67%, more than half the percentage of the population in the country, they are not having that even the basic sanitation facilities. Okay, so this was the report survey conducted by the World Bank, and this is the report given by the World Bank. So in order to improve the country's sanitation and drinking water facilities, the government of India initiated a program, the NDA government initiated a program called as the Swachh Bharat Mission. This is SBM. So this one was launched on October 2nd. Sorry. October 2nd, 2014. So this is more and more sanitation facilities will be provided by constructing the toilets. You are seeing the so many public places we are having this facility, isn't it? So that is the Swachh Bharat, so safe water and drinking to all by 2020. Of course, it's 2020 still it's not achieved to everyone, but still the process is on. Okay, then the next one is the increase the share of state on health to more than 8% of their that is of their budget by 2020. Actually, health and education they come under the category of state policy. See, there are certain which are coming under the category of central government, and there are certain areas that is the category of state. So this health and education is mostly in the state category. Only thing is, to a certain extent, the central government can share the burden. So the remaining major, see, whatever the health facilities, whatever the education facilities have to be provided in the state of Telangana, it is the responsibility of the state government of Telangana. Okay, maybe the central government can share the burden to a certain extent, but it is a state subject matter. It doesn't come under the central government subject matter. So that's why the share of the state government in this government, according to the population, according to the conditions, according to the requirements in this state of Telangana, so they have to put in more efforts and they have to contribute more share of their state budget. So like that, each and every state, according to the circumstances, they have to increase their budget. But minimum, they have to, I mean, the proposal is that at least more than 8% of their budget should be spent on health by each and every state government. Okay. So these are all the national, some of the objectives or some of the targets of the national health policy. Okay. And based on this, there are some of the health programs implemented by the government, both separately in the rural area as well as in the urban area, which I will explain to you in my next video. Okay. So if you find this video useful, please like, share, and subscribe. And if you have any doubts or suggestions, please mention in the comment box. Okay. So until my next class, take care. Bye-bye.